Sir John Bolton is here in a few minutes, but first, a new low. According to a Rasmussen poll, supporters for the president's health care plan is at an all-time low. Rush Limbaugh has a theory.
Support for health care plan falls to a new low, 41%. Now favor Obamacare, 56% oppose it. Support among seasoned citizens has fallen to 33%. Now, if you want to know why this thing doesn't get implemented until 2013, here is your answer. He's going to wait till after the 2012 election to make sure any of this stuff is implemented. Because once it hits, once the reality of it hits, he's going to have a popular revolt on his hands. And he wants 3 years or 4 years of his presidency left once the chaos begins. And we have all of these people working hard on it. And it's got to get done. It's got to get done. It's got to get done. We can't wait, but we're going to wait to implement it till 2013 because Obama knows we don't want any part of it. He knows we won't like one bit of it. And if it got implemented soon after it was signed into law, he could kiss his reelection in 2012 goodbye.
Joyce Live is Congressman Pete Hoekstra. Congressman Hoekstra is the ranking Republican on the House Intelligence Committee. Good evening, Congressman.
Hi, Greta.
Congressman, looking at the numbers in terms of how many people are in favor or opposed to the health care reform, at least as we suspect it's going to be this bill, of course, we don't know exactly what it's going to be. They've been pretty much constant for the last couple months. Why do you think that?
Well, I think the number is staying where it is and it's not improving for the president is because that the more that people learn about this plan, the less they like it. The second thing is they don't like the process. As Rush was just saying, it's going to be 4 years to implement this plan. But Nancy Pelosi and the leadership in the House, you know, they make a mockery of the process by saying members won't even be given 72 hours to review this bill. And then I think the most dangerous thing to the president is I think the American people are losing faith in his ability to provide the leadership to lead this country on this issue and on other issues. And the best example for that is the decision that I think has been made and made public in the last couple of, or in the last day or so, saying, you know, the General McChrystal sends a plan for Afghanistan to Secretary Gates. It's going to sit on the shelf until the president reaches the decision on a new strategy. But then this week, at the end of the week, he's willing to go to Copenhagen to make the pitch for the Olympics in Chicago. So people are wondering and believing that this president has his priorities mixed up.
Well, I think actually the thing that sort of caught my attention, many others, is that it's apparently General McChrystal says that he has only, in the number of days that he's been in that position, only spoken to the president one time, and he is the field commander in Afghanistan. And I think that probably, right, at least that caught my attention more, because who would know the story better than the guy who's actually there? But maybe the president has an explanation for that, and I look forward to hearing that.
No, that's exactly
anyway,
right. I mean, yep.
Go ahead, sir. Go ahead, sir.
I was going to say, no, that's exactly right. You've got the commanding general, and the commander-in-chief has only talked to him one time in the last 6 or 7 months. I mean, that is unbelievable when we've got troops in harm's way and things are not going well.
All right, let me ask you to go back to this health care for a second. This 78% of the American people apparently would like to have